1. Anterior Labral Tear Test. The anterior labral tear test checks the acetabular labrum, the cartilage rim that deepens the hip socket, for a tear at its front edge, a problem often linked to femoroacetabular impingement, FAI, abnormal compression between the ball and socket aspects of the joint. A torn labrum can cause groin pain, clicking, or stiffness, especially during twisting or sitting. To perform the test, the patient lies on their back with the hip and knee bent about 90 degrees. The examiner moves the thigh into a slight outward turn and abduction, then slowly sweeps the thigh inward across the body while rolling the hip inward. This smooth arc brings the ball against the front labrum. A positive result is the patient's familiar sharp groin pain or a mechanical click during the inward sweep, pointing to a possible anterior labral tear or FAI. Little or no discomfort is a negative result, although doctors often use MRI or arthroscopy to confirm the cause of hip pain.